We're gonna get it underway. All right. If I could get your attention, we'll try to get this underway and moving on expeditiously. Just over 15 years ago, the Medicare prescription drug program was narrowly forced through the House. Sherrod, Tammy, and I were serving there then, perhaps others, in the middle of the night after the clock was held open for 3 hours with a lot of arm twisting and threats. The pharmaceutical manufacturers that year invested about $100 million in lobbying, and they have reaped a giant dividend from that. Some have estimated it at $15 billion a year in benefits. They dealt with the opening of the largest market for pharmaceuticals in America, our seniors. Big Pharma ensured that it would retain a monopoly with one line in a lengthy bill: a direct prohibition of any negotiating with them over the prices that Americans were charged. Meanwhile, it's the taxpayers who've been funding much of the research and development for prescription drugs in this country. It's long past time for the Americans who've been paying for the research to get some return on their investment. From 2010 to 2016, every single newly approved drug by the Food and Drug Administration relied in some measure on taxpayer funding. Big Pharma relies upon the taxpayer money for research, and it relies on government-approved monopolies for its monopoly position with no countervailing force to restrain its prices. It can charge whatever a sick or dying person will pay for a little less pain or a little more time with their family. Prices for the most commonly prescribed drugs have been growing their price at about 10 times the rate of inflation. All of us want to see cures and treatments for dread diseases before we or our loved ones get them. We want innovation. But over a decade, 74% of all pharmaceutical patents were not for new cures, but they were for modifying existing drugs, often making very minor changes in what's called evergreening to preserve indefinitely their monopoly position. When manufacturers spend more of their profits and their tax breaks from the Republican tax law on stock buybacks, on marketing, on the full-page ads that are in today and yesterday's papers in color, than they're doing on research and development, they don't have much claim that they need to extort these kind of high prices in order to provide for innovation. We see, in fact, that monopolies traditionally have not been known as great innovators in any sector of our economy. Their monopoly power discourages innovation rather than encouraging it. So our goal today with this legislation, let's cut prices for patients instead of patients having to cut pills to deal with the problem that they've got. And we do that by trying to offer a truly American solution to an American problem, because it is almost unique to our country that these soaring prices are charged. Our American solution to this American problem is quite simple. It is to negotiate and then let competition work. We authorize the repeal of the Republican law that limits negotiation and give that authority to Medicare. And then we say if these drug companies won't negotiate in good faith, we will permit the Secretary to license generics to bring them in, to have competition bring the price down. What we're really doing today is just calling on President Trump to listen to candidate Trump, who talked about the way the pharmaceutical companies were basically guilty of murder, as he put it, in America, and said we need to start bidding and that we could save billions from doing so. So we repeal, try to get about the same kind of program that the Veterans Administration has for our veterans today. And if negotiations are unsuccessful, we bring in competition. We have a transition time that's there where we have the use of international prices, if that's necessary, to get the generics on board. And thanks today to over 100 House colleagues that have joined me, especially Congressman Welsh and Congressman Cummings, who had a conflict this morning with a hearing in supporting this legislation. And for the first time, this is very much a bicameral effort, and it's a bicameral effort with two people, three people really, but with the leadership of Senator Brown, who I would call on first, who have been leaders in protecting consumers in so many areas and who worked on this when we were colleagues in the House together and now play a key leadership role in the United States Senate. So thank you, Senator, and thank you. Welcome your insights.
Lloyd, thank you. Thank you. As on this and so many other issues, Lloyd, thanks for your depth and your understanding. When I heard there were 100 House sponsors of this, I was kind of thinking back 2 nights and hoping that like 50 House women would show up dressed in white and would start chanting USA, USA. And of all those speeches, especially the last couple of year speeches in the State of the Union, that was by tenfold the highlight of the 5 minutes of the anyway. So thank you for all of you that were in white coats work for that. So too, thank you. We know a handful of things. We know when Tammy and I served with Lloyd in the House and that bill passed. Robert remembers this. That bill passed in the middle of the night with the president placing calls into the Republican cloakroom with arm twisting, the likes we had never seen, because there was so much at stake. There were billions of dollars in drug company profits at stake. We know the power of the drug industry back then and still the power of the pharmaceutical industry. We know the White House looks like a retreat for pharmaceutical executives. We know that, except in the days they look like a retreat for Wall Street executives. So we know that. We know there are 4,000 drugs, name brand drugs, that had price increases this year, and we know with the passage of the Doggett, Baldwin, Brown, Welsh, Klobuchar bill, we know that 45 million Americans will have lower drug prices because either the drug companies play ball with the former CEO of the Secretary of HHS. We know that either the drug companies play ball and negotiate, or we have an alternative. It's a free market alternative. It works for consumers. It works to make the drug industry actually more competitive, which long-term is good for them. We know that taxpayers have been subsidizing this industry year after year after year, decade after decade after decade with research and development. We know they don't pay royalties back to us. We know they don't drop prices to pay taxpayers back. They continue to gouge the public. And this is an easy to explain, direct way of bringing prices down. We've done something similar at the VA. We know that's brought drug prices down. There's simply no reason after year after year after year we can't enact this, get this moving through the House, put the pressure on Mitch McConnell so that Senate Republicans actually, for a moment, just for a fleeting moment, turn their back on the drug industry and fight for the American public. So thanks again, Lloyd, and my friend Tammy Baldwin, who is a superstar on so many issues. Senator Baldwin.
Thank you. It's a reunion, a happy reunion. And I well remember that late night, early morning vote. You know, they actually kept it open because they didn't want to wake up the president too early. So we could have maybe had the vote at 4 a.m., but instead it was closer to 6 a.m. I remember the sun was rising when I left the Capitol that morning. So I want to put a name and a face on this issue. My guest at the State of the Union address was a woman from Webster, Wisconsin, named Diane Whitcraft. Diane was diagnosed with multiple sclerosis about 25 years ago. And for 23 years, she took medication that is intended to slow the progression of her MS symptoms. She changed insurance a couple years back and discovered that she had a much more sizable copay. So she actually had to research a lot more about what this drug cost. So when she started on this medication, it cost $10,000 a year. By the time she was switching insurances 2 years ago, the list price was just under $90,000 a year. And she ended up having a discussion with her husband that you wouldn't wish upon anybody, whether to keep taking the medication. She decided, and they decided that she would stop, that the financial impact of her continuing was too much. And she's an activist. She tells her story, and she's fighting not only for treatment and a cure for MS, but she is fighting to hold the drug companies accountable, make them more transparent, make them justify any price increases, and to empower Medicare to be able to negotiate for lower prices on behalf of all the people who are on Medicare. We have a broken system here in Washington when we have a system that prohibits the federal government from negotiating lower drug prices. It's just hard to understand. And I've long championed efforts to allow the federal government to do just that. This is a critical reform. It's long overdue. As my colleagues have mentioned, President Trump campaigned on this issue of lowering prescription drug prices, including this reform of allowing Medicare to negotiate with the drug corporations. But we haven't seen that happen. What we have seen is an enormous tax break conferred upon the pharmaceutical companies as well as the top 1% and large multinational corporations. We know that that tax break didn't pay for itself. In fact, we know it increased the deficit, and we know that it was very beneficial to the same pharmaceutical companies that we want to hold to account. By way of example, Pfizer received almost an $11 billion tax benefit from that bill, and then announced more than $10 billion in stock buybacks. Last year, they raised the price of 116 medications, and this year, they increased the price of 41 medications. We also know that the drug companies have a lot of power in Washington, but we're here today because we don't work for them. We work for our constituents all across this country. And together, we have got to tackle this issue. So thank you to my colleagues for all being champions, and thank you also to activists and organizers who are going to spread the word and make our voices heard.
Thank you. Thank you for all your work.
My pleasure. Are you?
I'm going to call Peter next.
Okay.
So thank you so much, Senator. One of the, and I know Senator Klobuchar had a committee conflict also and has sent over a statement and appreciate very much her leadership on this. One of the people who has pushed on this issue the longest and the hardest and who serves on the Commerce Committee, which has much of the jurisdiction over this issue, is our colleague Peter Welsh. He was with us when we did a form of this bill last year, and I really appreciate the work he's been doing. I want to call on him to say a word or two. Peter?
Thank you very much, Lloyd. This is a tremendous idea that you have as a practical way to bring the power of government to negotiate better prices. But I also want to thank all my colleagues. We've got some members who've been here a while. Shelley, good to be with you, and Mark. But we've got reinforcements.
Yes, we do.
We have reinforcements. And pharma, you ain't seen nothing yet. We've got the activists who've been hanging in all these years. And so thank you so much for your inspiring leadership. You know, Elijah Cummings and I met with the president about a year ago, April, and he said all the right things. I thought I was meeting with Bernie Sanders. Pharma's getting away with murder. We've got to have bidding. What's the problem with importing from Canada? You know, we can't import sawdust, but a lot of the drugs that we do get here are from there. So he said all the right things. And we were pushing on price negotiation along with Lloyd. And the question came up. He looked, the one person who was with us was the then Secretary of Health and Human Services. And I was pushing on it, and I said, part of the problem is, well, frankly, Mr. President, when your Secretary of Health and Human Services was in the House, he was against this. And Secretary Price, he'd just been hearing the campaign Trump speaking. And the president pressed him. And he said, well, is that true? And he says, well, Mr. President, we consider price negotiation to be price fixing. And you know what? There is price fixing. It's what pharma does every single day.
Exactly.
And the only problem with their price fixing is that it's high and then gets higher. And it never, ever stops. And how is it that that happens? That they are holding hostage the desire all of us have for people we love and for our own selves to be able to have life extension and pain relief. Why is it? The reason is because we let them do it. Our government is the only government that does not play an active, aggressive, and assertive role as a counterweight to the monopoly pricing power of pharma. All other governments step in and say, wait a minute, this is too much. Now, pharma's arguments that they've been making in the past, that they need it for research and development and innovative projects, over. Everybody knows that's, I'm going to just be polite here, it's a fib, okay? It is a fib because they spend more on advertising than they do on research and development. They spend more on stock buybacks. Thank you, President Trump, and the tax cut than they do on research and development. It's the taxpayers who are spending on research and development through the billions that we spend on the National Institute of Health and then license these products to the pharma companies. It's the research and development tax credit where they're able to write that off. That is courtesy of the taxpayers of the United States. So the real question here is, will our government, whose role is to serve the people of this country, start doing its job? And price negotiation is like market economics. You know, this Medicare program is the only program I know of where you buy wholesale and you pay retail. And that retail price is whatever they tell you it is. And that's it. And, you know, the suffering that is occurring, Tammy's story, that's true. That's a choice that families have to make. And you've got a mom or a dad who's thinking they may die and they're worried about it, but they're always worried about their kids more. They're always worried about their partner more than they're worried about them. And they don't want to leave those kids and that partner with a mountain of debt. So they make the choice that Tammy's constituent made. That doesn't have to be. And we're here to say it won't be. Thank you.
Thank you, Peter. Thank you very much. We're going to hear from the colleagues without whom this bill cannot become law, but I know Senator Brown's a little tight, and I want to be sure that you have an opportunity to respond to a couple of questions here. Do you want to do that?
For a minute, if anybody else. Okay.
Go ahead.
Sabrina.
I'm not sure.
I'm thinking if the House does what I think it will do, there will be enough pressure on Republicans to begin to actually reassess their allegiance to the drug industry. I mean, drug industry is as powerful as any industry in Congress consistently, right? I mean, what we've seen over the years, there's no question about it. But I think they're going to start when we continue to quote the candidate Trump and what he said, when we quote the president even more recently saying he wants to keep drug prices down. And this is a really, the beauty of this bill is it's easily explainable how we do it and what its impact will be, and call out the drug companies. I think we see some Republican members moving.
What about the president? Have you heard anything from the administration on this?
Well, I would only add that the Senate is where the president comes into play. We need a strong vote in the House. When this measure came up before in 2007, every Democrat voted for it. Not this particular version. I think this is a better and stronger version. But we passed it with every Democratic vote and 24 Republicans. If we can have a show of strong support in the House, great leadership from Senator Brown and his colleagues, that's where President Trump can come in and say, I want the bidding that I said I wanted in 2016. So that's what we're counting on. We have not had conversations in the immediate or recent past. I will talk in response to questions later about the proposals the President's put out and what he said at the State of the Union. Another question?
Senator Brown, I want to ask, there's a lot of talk like in the Finance Committee about doing very different measures. You worried about, standing up this sort of more ambitious maneuver and maybe crossing bounds with what like Grassley's doing in finance or Wyden?
Well, I support a lot of bills out there. I mean, there's the issue of reimportation that Senator Sanders has worked on, and a lot of us have worked on for years. Right. There's the issue of advertising. Peter talked about how much money they spend on advertising versus R&D and other things. Everybody's aware of the huge numbers of dollars they spend on advertising. That's an issue that we can go after in terms of tax deductibility. So it's kind of all of the above. But I also know the way the drug industry works in the Finance Committee, on the Ways and Means Committee, and the Energy and Commerce Committee, and just to all of us. They slow walk, they deflect, they say, let's do this, which is milquetoast, doesn't get us anywhere. So all that's going to happen. But we keep focused on one or two big issues that the House passes, and we keep reminding Senate colleagues that they actually have to deliver on something.
Unfortunately, there's no wonder drug to prevent prescription price gouging. And there's no one solution. It helps tremendously to have our leader be a member of the Senate Finance Committee. Senator Grassley has participated in some bipartisan investigation of drug pricing. It's really important. He is also, and we'll hear from Shelley Pingree in a minute, he has an importation bill. She has the House leadership on that. We want to see action on a number of bills. This just happens to be the central, and I think the one that can change lives the most.
There is no wonder drug, but there's an antidote. If I could play that metaphor out,
yeah.
There's an antidote to drug company lobbying, and that's the activists on this side of this end of both ends of the room.
One more before you go.
Senator Brown. Yes, sir. Just to follow up on support from the president on this matter, during his State of the Union address, he laid out that this is tops his priority in terms of lowering prescription drugs for American consumers. Do you see him as being an ally on this at all, someone you can work with? And then another topic here, to address the turmoil that's taking place in Virginia. Can you talk to that a little bit?
Yeah, sure. Well, it's not a Democratic perspective. I called on the governor to resign the same day that the story broke. Just because the president's a racist doesn't mean that we don't, as Democrats, speak out on something as serious as that. We work with the president as long as we can. I mean, the House has got to do what it can do, and we will hope that the president throws in on the right side of this consumer issue. The evidence in the past, whether it's a consumer product safety, whether it's a Consumer Financial Products Commission or a whole host of other issues, is he's always comes down on the side of the most privileged, wealthiest people and most powerful interest groups in the country. But I will keep trying, and we'll keep trying on drug prices. We'll keep trying on everything else. Thanks.
Thank you very much, Senator. Focusing back again on prescription drugs, I want to call up our colleague Mark Bocan, who heads the Congressional Progressive Caucus and has been such a voice since we first sought back in 2015 to get hearings, which the Republicans wouldn't give us. Mark was there with us making that demand and continues to be a key leader. Congressman Bocan.
Thank you. Thank you very much. And I want to thank Lloyd and the senators and all my colleagues and advocates who are up here. Especially want to, Lloyd has been so strong on this in the Congressional Progressive Caucus. We're about 100 members strong out of the Democratic caucus. Lloyd has been so outspoken on so many issues around prescription drug pricing. This is a high priority for the Congressional Progressive Caucus, this bill, to make sure this happens. And it's probably no surprise that Senator Baldwin and I both come from Wisconsin, because we often operate on what passes the smell test. When we have town halls back home, people come to us, and healthcare is always one of the biggest issues, pre-existing conditions and prescription drug prices. And it doesn't pass the smell test when, as Lloyd explained, 210 drugs, every single drug approved by the FDA between 2010 and 2016 had their tax dollars behind it. and the increased prices we see on prescription drugs would make a payday loan company blush. And the fact that we are not addressing this as a Congress, it just doesn't pass the smell test. And that's why we're saying with this new Congress, the public sent a message on November 6th, and they had a Democratic majority in Congress. And we are now going to try to stand up for the people, the 40% of the people that can't put together $400 for an emergency expense, and the 2/3 of seniors who rely heavily on their Social Security income, and this is 25% of that income going to medicines. We absolutely have to do something that private companies can do, other federal agencies can do. Medicare must do it. It'll save $16 billion. And I just really want to thank Lloyd for his leadership on this. We are going to make sure this is a priority in the Democratic caucus, and we're going to get this done.
Thank you. Thank you very much. As Senator Baldwin pointed out, the reason we can get this done is because we got some reinforcements. And coming directly to us from that great longtime Democratic stronghold of Orange County, California, is Katie Porter, who has really been a help on this legislation. Katie?
Thank you. Thank you so much. I've spent my career as a consumer advocate, working to help families who were being cheated by Wall Street. And I've seen how powerful Wall Street is in Washington, and that was part of why I came here. The pharma industry is no less powerful, and they are engaged in no less nefarious activity. Price gouging and taking advantage of consumers is no better when it occurs in the healthcare realm than when it occurs in the financial services industry. The 25 largest drug companies in this country from 2016 to 2015, 2006 to 2015, excuse me, had profit margins between 15 and 20%. Those seem awfully high to me. The reason they're high is because they're inflated by anti-competitive practices. We need to make sure that drug companies are charging what the market will bear, not what their industry lobbying dollars can produce. So I am here today as a consumer advocate. I'm someone who believes that when consumers need to purchase something, pay for health insurance and pay for drugs, when they contribute to Medicare, when they pay their taxes, that they should get a fair return on their hard-earned dollars. Every member of Congress should support this bill. Do you know who benefits from monopolies? Monopolists. So unless you're a monopolist, I expect to see you signing on to this bill and supporting it and standing up for our older Americans and for the quality of life and health care of our citizens. I could not be prouder to be here in my first few weeks in Washington, joining with some of my other young colleagues to be fighting for a fair health care system for this country. Thank you so much.
Another new member surrounded by pharmaceutical companies in New Jersey who fought a hard-fought race to get here and who has really helped in talking with other members about this bill is Congressman Andy Kim, and I'd like him to say a word or two.
For the last 2 years, I did hundreds of events across my district in New Jersey, and the number one issue that I heard about over the course of that campaign was the high cost of prescription drugs. Everyone says that the 2018 election was about health care, and it was. And in particular, it was about the high cost of drugs. People on both sides of the aisle coming to these meetings and telling me about their concerns on that front, especially my district where we have a significant number of seniors. And we understand that statistic that was said earlier, that 40% of Americans can't handle a $400 emergency. That is the times that we live in right now. And that is one of the generational challenges that we face. And when people have to pay $500 or $1,000 out of pocket every single month for life-saving drugs that they can't go without, and then I hear these stories that were told earlier, people skipping their medication or cutting their pills in half. Those are the types of struggles that I hear every single day in my district, and we said enough. That we understand the promises that are made to the Americans. We see how the VA fulfills that promise, allowing negotiations in their healthcare system. Now, Medicare, to me, is a promise. It's a promise that our country makes to our seniors. And the inability for us to be able to deliver low-cost, fair prescription drugs is breaking that promise. So this effort to me is so fundamental. This is not some incremental step. It's about the foundation of our promise to seniors in this country about Medicare, that they will be taken care of. And I see this as that critical step to make sure we fulfill that promise to everybody in the New Jersey 3rd and across this country. Thank you.
Thank you, Andy. You ready? From the warmth of Chicago, we have a great new colleague, Chuy Garcia.
Thank you. Thank you, Congressman Doggett, and to all of my congressional colleagues. I'm very delighted to join each and every one of you today in sponsoring legislation that will require the Secretary of Health and Human Services to do the right thing, and that is to negotiate for fair, more affordable prescription prices for Americans all over. As an example of why this needs to happen, Latinos, who comprise 17% of the population, are some of the higher risk for type 2 diabetes, and it places a large percentage of the population in the district that I represent as in that risk group. The cost of insulin, for example, has nearly doubled from 2012 to 2016, putting patients' health at risk. My constituents have been asking me to support legislation to make modifications such as medications such as insulin more affordable. This can be done, and it makes a difference between life and death for so many people all over our country. Lastly, my special visitor at the State of the Union address was my wife. Why? Because she is an ambassador for people with disabilities living with multiple sclerosis. If we did not have the type of insurance we've been blessed for the past 8 years, she might not be able to come to the State of the Union. The cost of providing the medicines that she needs to walk, to live, to be a grandmother is exorbitant. That's why this is an emergency, and pharma needs to do the right thing by the American people. Thank you.
Thank you very much, Chuy. One of the obstacles we've had is the House Ways and Means Committee. Now it's under Democratic control, and it is in part because a number of the Republican members there were replaced. One in Minnesota by Dane Phillips, who joins us today, along with his Senator Amy Klobuchar in absentia. Dane, Jane.
Hi, everybody. As my colleague Andy Kim just said, our freshman class, in addition to every member of Congress, has been listening. And what we heard in district after district after district around the country is this issue, the cost of pharmaceutical pricing. And it's not unique to Democrats. This is not a political bill. This is an American bill. Republican colleagues heard the exact same thing, and I want to make that clear. I also want to make clear that this is not about punishing the pharmaceutical industry. This is about ending the punishment of American consumers and taxpayers. And we do not have to bring out our small violins and play My Heart Bleeds for You, pharmaceutical industry, because, as everybody knows, there are 200 other countries around the world or so that the pharma industry can simply raise prices ever so slightly. And everybody, in effect, in this country can be winners. That's what this bill is about, and I'm so honored to be a part of it. Thank you.
Thank you. Right. Reference earlier to the fact that there are a number of pieces of legislation that need to be approved. One of the first supporters of this measure lives right next door to a place where you can get lower priced prescription drugs. And so I'm pleased that Shelley Pingree is here from Maine to talk about her bill and offer her support for this one.
Thank you. And thank you, Lloyd. Thank you to everybody who's here, the senators, the newcomers, the oldcomers, the activists. We're just really glad to be putting the focus on this and, frankly, to have a Democratic majority so that we can put this bill up in front of committee hearings, bring a bill to the floor and allow the Senate the chance to say no to a wonderful bill, which they will not do, mark my word. And it was great to hear the president the other night bring this up again. So we want to give him some really good alternatives that come to his desk, and he can put his money where his mouth is, as they said. So I'm a wholehearted supporter of this bill, proud to be a co-sponsor of it. And I do think that negotiating for the best price is where we have to go. I go all the way back to being a state legislator. In the 2000s, we passed a bill in the state of Maine at the state level to negotiate for prescription drugs based on all these same principles, not using Medicare but Medicaid. And we actually had a challenge from pharma. We won at the United States Supreme Court in 2003, proving that this principle is absolutely right. And I want to say one thing. When we were working on that, and it took a long time to fight against pharma and to convince everybody, I was the Senate Majority Leader, and Angus King, our now senator, was the governor. And when I finally got him on the right side of that issue, because it is a complicated issue how you negotiate, and he understood that every other Western nation negotiates for the right price on prescription drugs, he thought up something that I'll never forget. He said, it's like when you're on the airline and you realize that everyone else got the cheap seat and you paid full price. And that's what we're doing in the United States of America today. We subsidize every country around the world who gets these great prices because we don't have the guts to stand up and negotiate. And that's what the American people, of course, expect of us. And there's only one reason why we don't do that. And you heard about that vote in 2000, I think, and 3. And we've been in a bad place ever since then. But this is a chance to turn it around. And my bill, which is sponsored by Senator Grassley in the Senate, so you can see this is a very bipartisan issue. Peter Welsh and I, he was here earlier, know this issue very well, and that is the idea of walking across the border into Canada and buying your drugs, sometimes at 1/5 of the price, 1/2 of the price, 1/3. It's the same packaging, the same companies, it's everything exactly the same, but Canadians do a great thing for their people, and they negotiate for the right price. And I spent a lot of time in Maine, especially as a state legislator, taking bus trips of senior citizens, and we would pick them up at stops all along the way going up through the state of Maine. We'd stop in Calais, Maine, visit with a dually licensed physician so they could rewrite their prescription, and then walk into a super drugstore that looked just like any old American drugstore in Washington, D.C. or Portland, Maine, and they would take the prescription to the counter, and they would pay, as I said, sometimes only 20% of the price. If you were reading The Hill today, and I don't know if there's anyone here, they have a wonderful story about a man who travels to Canada 4 times a year. There's all kinds of issues that are thrown up by the pharmaceutical manufacturers. Oh, it's not safe. Oh, it's this. Oh, it's that. Give me a break. Canada is not giving their citizens counterfeit drugs at their big Walgreens and what other their big grocery and drugstores are. So that is really a symbolic way to say, hey, if you can do that for them, why can't you do it for us? In the long run, we got to have price negotiation, and we have to tackle a lot of different issues about prescription drugs. So I'm just really proud to stand here with my experienced and very knowledgeable colleague, Lloyd Doggett, who has been dogged on this issue for a very, very long time. And I look forward to seeing some revolutionary change this year on the price of prescription drugs. So thank you.
We're all available to respond to questions at this point. I do want to, before calling on those questions, acknowledge the leadership of Rob Weissman at Public Citizen, the important role of Public Citizen, the American Medical Student Association, Center for Popular Democracy, our Alliance for Retired Americans. They're all here in T-shirts and supporting this effort. And you know, what's going to make the difference is if we can get enough citizen interest out there to get some of our colleagues to overlook the power of this lobby and do what's right by America. The story that Tammy told is the kind of story each of us have heard again and again, and we salute especially and thank especially those people who've had the courage amidst an illness, a sickness, to speak up and tell their story, and now we need to respond. But we're ready to respond to any questions you might have. Yes.
Thank you. Thank you. 2 questions. One, the pathway through the House, will this be get a hearing in Ways and Means, and have you been assured a House vote? And then you mentioned the international reference pricing that Donald Trump called for on during the State of the Union. How does that play in, and do you see Democrats working with the White House and Senate Republicans on that sort of model too?
My goal in the House has been to assure that all the jurisdictional and multiple committee interest that sometimes slow bills down help to accelerate this one. So Elijah Cummings, who's one of the sponsors of this bill, has already had a hearing in House oversight. Congresswoman DeGette has a hearing about the diabetes problem and what's been happening on insulin. There are other hearings set in the Commerce Committee. We will have a hearing next Tuesday in Ways and Means about this problem. As chair of the Health Subcommittee on Ways and Means, I expect to have a hearing in early March about other aspects of it. So there are no guarantees yet. There are a number of different approaches that are out there. I hope we can come together behind something now that we're finally getting the hearings we were denied for years and can fashion a solution that, as I said, will enjoy a strong enough House vote that will attract President Trump's attention and some movement in the Senate. On the international pricing approach, basically we use it as a backstop, recognizing that generic competition is what we're seeking, but that there could be a period of time, I think currently we provide for a year, for those generics to come on market to provide that competition. And during that time, we use an international price. We have a formula in here that looks at other modern countries, all of which, like Canada, are charging their customers substantially less. So there would be a price put in place while the generics are coming online. As far as what President Trump has done, I can comment on that at greater length. He does make reference in his Part D proposal to international prices. That's one of the things that has inflamed pharma the most. But that program that they're talking about is for a relatively small number of drugs, and it's a demonstration project. It doesn't apply to the whole country. They will pick a part of the country and try to use that model. I would applaud their reference to international prices since they are so much lower than ours, but their program, and Peter, you may want to if you add anything on that, but it just does not do enough on Part B, the infusion, the physician and hospital administered drugs, and then we can talk about what they most recently proposed on Part D. I guess the last thing I would say is there has been a suggestion at several times, not quite as clearly explained the other night by President Trump, that somehow if we lowered the price, if we raised the price of drugs in countries that have effective negotiation, somehow Americans who don't have effective negotiation would pay less. And that is a nonsensical argument. If Canada has to pay more for its drugs, we're not going to get a better break here. Pharma will just get more in profits. Yes, sir.
Can I ask again a little bit about the, I guess, tactic you're taking of, like, putting this out, saying this is a good idea, this will make a big impact. We really want the president to come on our side of it. Whereas I'm kind of getting the impression the White House is saying, why don't you take some of our ideas and work with them? Things like capping Part D out-of-pocket costs. I guess my question is, how much room for compromise is there on this? It sounds like what you're saying is we need to be bold here. How?
We do need to be bold, and as far as compromise, we're willing to agree completely with candidate Trump. That's the very approach that we are taking here, and then we're giving a specific way to accomplish what he said. If you only have bidding and you don't have any power to do anything about those who won't compete, who won't negotiate fairly, then you don't get any place. And so we provide a specific way to encourage negotiation to happen in good faith. Since you mentioned the Part D aspect, the rebate at the counter that is attracting some attention. I heard Secretary Azar say the other night that we don't need bills like this because we already have negotiation under Part D, and the negotiation comes from the insurers. Well, it's interesting that the Part D proposal, the one part of the process existing now that they attack are the folks that are doing the negotiating, which he says are doing the job that we would substitute Medicare doing. And I don't deny that there's some problems. I know, Peter, you've seen them as well with what's happening between manufacturer and consumer. But a proposal that does nothing about manufacturers' prices, and in fact, their rebate proposal will cost taxpayers $200 billion more They admit it will raise premiums on Medicare recipients, and I don't see the benefit. Plus, I do see who's celebrating, and the one group that praised former executive Azar for this proposal is pharma. You want to add any? No. Okay. Thank you. Are there? Yes, ma'am.
So I have a question for you and also Congressman Welch. You introduced another drug price negotiation bill last month. What's sort of the balance here between those separate bills and moving forward for a House vote?
You know, the bottom line here is we got to lower the cost of drugs, and there's a number of ideas out there. And what we're going to be doing in Ways and Means and in Energy and Commerce is starting to get testimony and then building a political consensus for doing something that's effective. And it might be this idea that I think is terrific that Lloyd is the leader on, or it might be another one. Bottom line, we have a common goal. And the dynamics here have changed a lot. You know, Paul Ryan did a good job for pharma. He did not allow the House to vote on any bill that would allow prices to come down. So he protected his members from even having to vote. It's a different situation when a bill goes on the floor and my Republican colleagues, whose constituents are suffering the same pain that Lloyd's are, that mine are, they have to vote. And their choices then, they go with their constituents and consumers, or they go with pharma. New dynamic here. So we're not going to have a problem working out the various ideas. This is a really well-developed idea that I think could be incredibly effective. But there's not going to be any pride of authorship on our side. There's going to be pride of accomplishment.
I think that says it well, very well. And I would just add, Congressman Cummings, who couldn't make it here this morning, I've signed on his bill. I've signed on Peter's before. We're trying to get the concept out there and then let the competing approaches out of that to come up with the best solution, the one that can get the most votes here. The problem that I seek to deal with in this bill is the argument that is made, and I've heard Secretary Azar and our Republican colleagues going back to their phony death panel days argue this, is that the only way you get prices down is to have a formulary, and the formulary, by its very nature, will say if you won't negotiate in good prices, in good terms, we will not provide coverage for your drug. And so then they're able to make the argument that Medicare will deny some valuable drug to someone because it's been cut off the formulary. This is an alternative to a formulary. We're going to make all drugs available. We're going to have competition, and we're going to go right to the heart of what pharma considers to be most important, and that is their patent, their government-approved monopoly. We will honor that patent. We will not have any generic company come in and compete with them that does not pay for licensing under their patent. But we will let competition drive down prices, and every drug will be available, but hopefully at a price that is a little more affordable. Are there others? Yes, ma'am.
What kind of buy-in have you gotten from House leadership on this proposal? My understanding is that they're working on their own ideas around Medicare pricing.
We continue to have discussions. One of the other ideas that has been advanced that we haven't talked about yet this morning is the idea that you can use some kind of arbitration to solve this problem. I wouldn't rule that out as an alternative. I think it has some limitations. One of them is that if the secretary, whoever that person might be, a day when we won't have a former executive running the Health and Human Services, but if the secretary can always say, I'm not responsible for what was decided here, it's that other guy that was the arbitrator that decided. That allows for a little shifting of responsibility. There is also an issue about given the complexities of arbitration and the power that pharma has shown to take advantage of complexities, whether you can arbitrate over a broad enough range of drugs or you aren't limited to just a handful. And I think we need to provide relief to the various issues we've seen whether it's insulin or an oncology drug, that we need to cover a broader range, perhaps phased in, of course, but not limited. So I think there are a number of challenges in using an arbitration approach, but it's one of those, just like formularies, that we need out there to discuss and see where we can generate the most support. Anyone else? Well, again, thanks to all of you for coming, and a special thanks to those groups that are out there organizing, getting people to call their members of Congress. We can make a difference and get this done. Thank you.